Namaste. My name is Dr. Prajwal Dhungana. I am Hybrid International Emergency Medicine ITR and an associate member from Royal College of Emergency Medicine. I am currently posted at Chitwan Medical College Emergency Department. I would like to welcome you all to my video presentation. I'll be talking about my quality improvement project and my thesis. The title of my quality improvement project is Management of Community Acquired Pneumonia in CMCTH ER. Community acquired pneumonia is a common disorder with an incidence of about 20 to 30% in developing countries and 3 to 4% in developed countries. During my work as an ITR at CMC, I encountered many cases of community acquired pneumonia. I identified that correct stratification of patient according to severity were not done along with correct antibiotic prescription. So I used Curve 65 and NICE guideline on antimicrobial therapy as a screening tool to observe patient practice at CMC. My first cycle of audit revealed 57.58% of the patients were stratified incorrectly and 60.61% of patients were not prescribed with correct antibiotics. Curve 65 scoring was not documented at all. This can lead to high risk of mortality, antimicrobial resistance, and unnecessary financial burden on patients. A study done by Launders et al. In 2019 concluded that CRB65 scores are seldom recorded in UK primary care. A study done in Nepal by Lochan et al. In 2015 concluded that CURB65 scores should be incorporated into assessment of CAP during admission, as they predict adverse outcomes both in terms of mortality and longer length of hospital stay. In review with World Academy of Medical Leadership at United Kingdom, I'll process map 4 cycles of audit and make sure quality improvement has been achieved on management of community acquired pneumonia. Ladies and gentlemen, let me talk about my thesis starting with a case. Let me present to you Mr. PD, who was brought to A&E by paramedics with alleged history of motorbike accident impacting his abdomen. Upon arrival at A&E, he was tachypneic, tachycardic, blood pressure was low at 60/40 and he looked confused. I immediately suspected him to have internal bleeding, a surgical emergency. Without proper treatment, he would have died in a matter of minutes. Given the history, it's clear as to what was going on. Most immediately, PD was in hypovolemic shock, a drop in blood flow due to low blood volume secondary to internal bleeding. The radiologist was out of town, so I did a fast scan as I had some training. I found out that there was free fluid in the abdomen. Immediately, a surgical consultation was done and the patient was taken to the surgery. Operative findings revealed a ruptured spleen. Surgery was successful and a life was saved. So the title of my proposed research is Competency of FAST Scan among Emergency Medicine Residents of Chitwan Medical College. It will be a prospective observational study. Focused assessment with sonography for trauma is an important skill during trauma resuscitation. Intra-abdominal hemorrhage due to blunt abdominal trauma is a major cause of trauma-related mortality worldwide. And in countries with limited resources like Nepal, USG can play an enormous role in timely intervention and lowering mortality. A study done by Smith et al. In 2010 concluded that in rural areas with limited resources, FAST scan may assist in timely transfer of trauma patient for further imaging or definitive surgical intervention. A study done by Basir et al. In 2016 concluded that the emergency physicians can use ultrasonography as a safe and reliable method in evaluating blunt abdominal trauma. A similar study is yet to be done in Nepal. The impact of my thesis is that it has the potential to make a difference to majority of people in rural areas. General objective of my research is to determine the competency of FAST scan among emergency medicine residents. In review with Institutional Review Committee of Chitwan Medical College and World Academy of Medical Leadership at United Kingdom, I will process map my action plan in 4 years. If my research comes out with a positive result, I want to establish protocol of FAST scan during primary survey by emergency medicine residents. HIEM ITRs will get an opportunity to train and improve USC skills, and in future, there is a need of outreach program to train emergency doctors in rural areas in Nepal. This will definitely help in quality improvement in long run. To summarize, I believe with continuous guidance from CMC IRC, WAML, and my teachers, I will achieve quality improvement through my projects and make an impact. Thank you.